program was highly anticipated. Politicians doing the right thing, getting the funding, getting the support, literally Joe Baca Jr. making the connections, saying trains doctors to be here. It would be so great if we have physicians that were raised here, that were educated here, and that are now serving here. So, latest update. We're just going to read this article from the Desert Sun. Pretty much answers a lot of questions. What is going on in San Bernardino County as far as healthcare? Now, for those of you who have been following me on other social media like TikTok, y'all know that I posted this video real quick. It can't be just me that has a hard time making an appointment with a doctor. It seems like the soonest appointment I can get is 1 month out. To mention, you can't even see your own doctor sometimes. You have to see some nurse practitioner or some other physician. It's impossible to see our own primary care doctors here in the IE. And I think I finally understand why. Here's a clip from one of my live streams where I read this article on a study from the University of Wisconsin. The University of Wisconsin health rankings shows one primary care physician per 1,230 residents in California. In San Bernardino County, it is one doctor for every 1,700 residents. It's even worse in Riverside County, where there's one physician for every 2,160 people. Crazy. Because the doctor to patient ratio is so high, it makes sense now why it's impossible to get an appointment with your doctor. Absolutely impossible. Like, you have to schedule being sick to be able to have an appointment with your doctor. That's how crazy it is. Why don't we have more doctors? If you want to learn more and try to figure out politics together, hit subscribe. Follow me. We have updates. One of our great Board of Supervisors, Joe Baca Jr. for San Bernardino County, was very, very proud to get this program going. This Cal State San Bernardino Physician Assistant Program by Jennifer Cortez from the Palm Springs Desert Sun. The highly awaited Physician Assistant Master's Program at California State University San Bernardino, which was shut down after it failed to gain provisional accreditation, was found to have serious staffing and curriculum deficiencies, according to documents newly released under a public records request from the Desert Sun. The program, which would have been the first of its kind in the California State University system, was intended to expand access to healthcare education, particularly in underserved areas in the Inland Empire. CSUSB President Tomas Morales has called the program a game changer for both the campus and the region, which has one of the nation's lowest ratios of primary care providers to patient. Oh, wasn't there just a great TikTok that we saw where some random girl from the internet was talking about how San Bernardino and Riverside County have atrocious patient to doctor ratios. Elected officials had secured funding to launch the initiative. Former state senator Richard Roth helped secure more than $16 million for the project. $16 million, while U.S. Representative Pete Aguilar and U.S. Senator Alex Padilla obtained an additional $2 million in federal support. But the Accreditation Review Commission on Education for the Physician Assistant, the national accrediting agency for such programs, initially denied CSUSB's program a provisional accreditation on July 18th and reaffirmed that decision in a letter dated August 8th. Titled Adverse Action Upheld. The letter addressed to Rafiq Mohammed, CSUSB's Provost and Vice President for Academic Affairs, detailed the 8 areas of non-compliance. Okay, so this Rafiq Mohammed, got the letter saying why Cal State San Bernardino did not get accredited. When the program's closure was first announced in August, program director Sonia Ott told students in an email that CSUSB disagreed with the accreditor's review and conclusion, but was bound to honor their decision. At the time, details of the deficiencies were not made public aside from references to insufficient staffing, noncompliance with accreditation standards, and a lack of evidence demonstrating program readiness. The notice, obtained by the Desert Sun through a California Public Records Act request, detailed the 8 citations where the program fell short of accreditation standards. Okay, so like they couldn't the school couldn't even like admit to why there was what the bad standards were, and like they just said that they disagreed with the decision, that it wasn't sorry, what did they say? Told students in an email that CSUSB disagreed with the accreditor's review. Like, how do you disagree? Keep that in mind, chat. Keep that in mind that we look over these 8 reasons why they couldn't get accredited. ARCPA, that's the Accreditation Board, Accreditation Review Commission on Education for the Physician Assistants. The accreditor said the program lacked sufficient faculty, staff, and administrative support to function effectively, raising concerns about its ability to manage instruction, student services, and operations. Crazy. How do you not have sufficient staff? Second one is too few principal faculty. Okay, so I think principal faculty means like the important ones. I don't know. The program did not employ the required minimum of 3 full-time principal faculty members, including 2 certified physician assistants, licensed clinicians who have completed an accredited training program, and national certification. So they didn't hire 2 physician assistants to actually teach this physician assistant program. That's crazy. That's what I'm getting from this. Like, how big was this department supposed to be? I want to know how big that department was supposed to be if they couldn't even hire the minimum of 3 full-time principal faculty members. Oh my God. Okay, and then number 3, faculty shortage at launch. Even beyond the minimum staffing, the program did not show that it had enough qualified faculty to meet the academic and administrative workload or support the number of expected students. Fourth issue here. Some program leaders were classified as administrators under the university's management proposal plan, an employment category for managers and supervisors who are not considered faculty. Okay, like faculty, that's like teachers, right? Right, chat? I'm not dumb, right? Faculty means teachers. Leaving them without academic privileges such as tenure or participation in the faculty senate. The 5th one was vague learning outcomes. The accreditor found that many course objectives were written using vague or non-measurable terms such as understand or recognize, making it difficult to assess whether students have achieved competency. The 6th one was weak student assessment. Evaluation methods for student performance were too general and did not clearly outline how deficiencies would be identified, remediated, or tracked. Okay. 7th issue is late faculty hiring. The program failed to hire its core faculty, including at least 2 full-time care physician assistants and principal faculty members, at least 9 months before the accreditation site visit to ensure adequate participation and curriculum development. Okay, so they didn't have anyone. Watch the School was like, we're in the hiring process still of trying to hire someone, and that's why they didn't get they didn't have enough staff to like. That's crazy. The 8th and final thing is incompetent course documentation. Several courses and clinical rotation syllabi were incomplete and lacked clear, measurable learning objectives, leaving gaps in how instruction and outcomes would be documented. Crazy. The accreditor noted that CSUSB's reliance on administrative classifications for key academic positions created confusion about faculty status and authority.
Although the university said it had converted those roles to faculty appointments, the accreditation organization found no signed or verifiable contracts to confirm the change, according to the report. Some contracts had already expired before the program's planned start date in August. What the frick? As such, RCPA reaffirmed its decision to deny CSUSB's provisional accreditation, upholding all 8 citations. The program's future remains uncertain as it can't matriculate or accept applications until CSUSB reapplies and shows that the deficiencies have been addressed. The letter had outlined 2 possible next steps. CSUSB could reapply for accreditation after correcting the cited issues or withdrawal from the process altogether. While the university has not publicly stated whether it would reapply, CSUSB has said it is working with state and federal partners to redirect funding towards other health programs. So I think that pretty much gives the answer that they're choosing option 2. They're saying we're just not gonna go forward with this program anymore. Stardust said the reasons are brutally worded, which means they really piss somebody off, rightfully so. Thank you. That's crazy. But yes, makes sense. Yeah, so some of the 8 reasons sounded a little bit redundant, right? But it's probably very, very bad. And it's no surprise, honestly. Like, even if I wasn't a CSUSB student, I wasn't going there, 4 out of 7 days of the week, I still would know that CSUSB is having issues. They have been having problems. Like, this program not getting off the ground is like, it seems like it's kind of in line with the tradition of how things have been run at the school lately. Another article here titled Audit Finds Cal State San Bernardino Student Housing Program is Deeply in Debt. Program must pay $8 million each year in debt payments. That's crazy. Another thing that's in the news, there's been drama at the Palm Desert campus with Jake Zhu. Former Cal State San Bernardino administrators claim they were fired for discrimination complaints. Former CSUSB Palm Desert official wins $6 million over gender discrimination. That's crazy. $6 million. I mean, she deserves the whatever she was awarded, because who knows what kind of discrimination she had to put up with. But like, as a student whose tuition is going up, who hasn't bought a parking pass, and it's literally 1 month left in the semester, and I refuse to buy a parking pass because it's too expensive. Like, it's just so frustrating that there's all these things, the prices keep going up, and it's like, well, because you're like wasting $6 million over these lawsuits. Joe Baca Jr. was so excited to announce that ARMC, Arrowhead Regional Medical Center, will partner with Cal State University on a physician assistant clinical training program. It was all perfect. It was literally, there was students there was hospital here, there was county with immense need for more doctors. Like, y'all don't even understand that I shared earlier. There was like so many people in the comments so annoyed. Kaiser Riverside scheduled all my prenatal appointments for me throughout my pregnancy, and every time it was a different doctor. I'm in LA, and it took over a year to diagnose me, mostly because I could barely get an appointment. Another person said, yeah, I used to work for a cardiologist in Riverside, and the appointments were set from a month to 2 months in the future. It was so bad. So someone else said, I don't know, girl, I go to Kaiser in Northern California, and they always got us booked out a month. It sucks to live in Lompoc, California, because I'm disabled and I get mistreated by my doctors and get denied a specialist doctor, and I've tried every doctor. It took me 3 months to finally see my OBGYN for prenatal care. I'm almost 20 weeks pregnant. 20 weeks pregnant, and this is the first time seeing an OBGYN. Oh my God. They do not pay primary practitioners enough, and NPs and PAs are just as good as physicians. Yes, I agree with that. Both can give me a prescription. That's all I need, you know. The Inland Empire does not have a very good primary health care. It's better to move out west if you can for better care. And by out west is to LA, and to like literally get the same doctors that all the celebrities, athletes, actors, all the big wigs in Hollywood, all of those people, I'm still going to have a hard time to see those doctors too, because they're booked up. So yeah, it's bad. So yeah, like this program was highly anticipated. It was like, dare I say, even the right move, right? It was all these politicians doing the right thing, getting the funding, getting the support, literally Joe Baca Jr. making the connections, saying, yes, Cal State San Bernardino is a school that is in this county, and there's no other schools in the county that actually trains doctors to be here. It would be so great if we have physicians that were born here, that were raised here, that were educated here, and that are now serving here. That was a great vision that everyone, no matter, I don't care if you're left, right, center, libertarian, anarchist, like we all humans need to see doctors, right? And getting the right people to do the right moves was this. And all for the ball to be dropped by who? Who dropped the ball? That's right. It was Cal State San Bernardino. What the F, man? How? And it was such an easy ball to not be dropped. All they had to do was hire people. They had the money. Why couldn't my freaking college, why couldn't this school hire the people that were needed to get this program going? Like, I have to also remind everyone watching this video that there was already students enrolled to start being educated in this program, right? Ugh. If you're one of those students for Cal State San Bernardino's physician assistant program, what happened? Like, are you going to another school now? Are you not going to school at all? Like, please, if this impacted you in any way, leave a comment in the video, comment in chat right now, like DM me. I need to know. Like, this sucks. Everyone, you know how long it takes for all of this bureaucracy to go, right? For all of the steps to be taken, all of those things to be all of that red tape, all of that for who to drop the ball? Cal State San Bernardino. It was literally the last step, right? All we had to do, there was students waiting. All you had to do was hire the appropriate staff to teach these students. And they did not. That's crazy. 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 And now what is this school doing? Trying to send the money away. All the money that we secured the funding for. Like, that's also, how hard is it to actually secure funding for things? We actually secured the funding, and it all came down to not hiring the right people. What's up, Cal State San Bernardino? What happened? We need answers. Real answers. Not like, oh, it's a disagreement between us and the organization who's going to give us accreditation. No, we need real answers, brother. Oh, sorry for that rant. That was building up from my favorite Inland Empire Community News. All right, here's this dude, the president, the guy who makes all these decisions, right? In the 51st year of his career in higher education and his 13th year as president of California State University San Bernardino, Tomas D. Morales has announced that he will step down from the post at the end of the 25/26 academic year. The announcement was made at the university's annual convocation of faculty, staff, and administrators on August 21st. After speaking about the accomplishments of the university and challenges of the new academic year, Morales said, "It has been the honor of a lifetime to serve you as your president, and I look forward to moving into this next year with you. He shared his pride in the institution, adding, "These are not just words, they are what I truly feel and what I believe, and I have a great deal of confidence in you and the future of our campus." Morales began his role as CSUSB's fourth president in August 2012. His commitment to students' success has led to various innovative summer bridge and other student and academic support services, including strengthening relationship with public K through 12 school districts and community colleges in the Inland Empire, which honestly he has done. I mean, I don't know if it's been all him, but I'll tell you, this whole past week at school, which has been the week from hell, honestly, 2 weeks from hell, because it's been nonstop midterms, there has been an endless amount of high school students touring the campus. Like, it's been every day, this direct admission thing that Cal State San Bernardino is doing, which, I mean, I don't necessarily think that's a bad thing or anything. I just hate seeing all these, you know, literal babies. Like, I'm around children every day already because I go to school with 18, 19, and 20-year-olds. But to see literal children walking around the campus in lines, like, and it's been a lot. Sorry. I just had to get that out. Morales said that the appointment process will be managed and confirmed by the CSU Board of Trustees over the coming months, and called on the university community to participate in the upcoming open forum and provide your input through your campus representatives throughout the search process. More information will be forthcoming from okay, whatever. So anyways, yeah, this guy's stepping down. Crazy. What a time to step down. Literally, one thing that blows my mind about the CSU system, inside Cal State's big 17 million bet on ChatGPT for all. Okay, so literally when I started school 2 years ago, or every professor was like, don't use AI, don't touch it, it's a bad thing. The less you know, like abstinence only education for AI, right? That's what it was. And now, literally, our schools bought AI for us to use. Crazy. Okay. Critics say the cash-strapped system misspent millions of dollars getting upgraded accounts for all students. CSUS leader insists they're needed to meet a changing economy.